Hi, I'm Carly and I'm doing the nervous system, and the disease that we chose for the nervous system group is amyotrophic lateral sclerosis. So first I just want to go over the nervous system. So like I said, our disease is amyotrophic lateral sclerosis, and this is a nervous system disorder. The nervous system, it consists of the central nervous system and the peripheral nervous system. The central nervous system is the brain and spinal cord. The brain contains the cerebrum, midbrain, medulla, and it carries out our higher learning function, thinking, everything like that. It has to do with the brain. The spinal cord is going to be it's going to help carry out action and bring information to the brain. And then I got a diagram of the nerve. So see, the dendrites bring information, and the action potential travels down the axon to the axon terminal. And over here in this area would be another nerve, and it goes all the way down the line until a muscle is moved, if that's what that nerve is doing. So you have your neurons and your interneurons, or your motor neurons and your interneurons. Your interneurons bring information to the brain from your sensory receptors, and your motor neurons, your interneurons take this to the brain. It gets interpreted, and then an action is sent back out to through the motor neuron, which causes movement of some sort. Whether that means that you're going to move your leg because something is bugging it, or causing some sort of discomfort, or what have you. So what the nervous system, I'm going to show a video real quick, and not the whole video because it's a very long video, but it's the ice bucket challenge.
I accept the challenge from Brandon Williams, Kevin Durant, Kevin Hart, and DJ Steph Floss, and I nominate LeBron Jr., Bryce Maximus, and President Obama. LL's challenge. One, two, three. I nominate Cindy LaRue, Nike CEO Mark Parker, and Element's Johnny Sheila Rose. My go. Oh, that's cool. This is Adam.
So if you can recall, a few years ago, the ALS Ice Bucket Challenge inspired many people to pour a bucket of water in their head, nominate 3 friends, and donate money to this cause to gain awareness and research for this disease. Now, one of the reasons why they did the Ice Bucket Challenge is because it's supposed to emulate the feeling of what's going on with a person that cannot carry out that action potential. So again, we're doing amyotrophic lateral sclerosis, also known as ALS, and it's called Lou Gehrig's disease. It's a neurodegenerative disorder that affects the motor neurons of the brain and spinal cord. With the degeneration of the nerves, it causes atrophy of the muscles because no action potential is being sent to that particular muscle, which is causing, that means that it's not being able to be worked or moved, so it loses its definition and wastes away, essentially. And then I broke up those words: neurodegenerative, so condition of progressive nerve damage. And then I went ahead and broke up the full name of the disease that we're covering. And I wanted to include this, the myelination. So the myelin sheath is around the axon of the axon that's carrying out the action potential. And with this myelination, it's able to conduct impulses faster. But these are affected as well.
Okay, so for signs and symptoms, we're going to start off with myasthenia, which is muscle weakness, dysphagia, which is slurred speech. There's also cramps and twitching of the muscle, dropping of tripping, so there's like the droopiness, abnormal fatigue in the arms or legs, and there's uncontrollable laughing or crying. So for diagnosis, we're usually diagnosed by a neurologist through neurological work. There's something called an electromyography and nerve conductive velocity, which are electrical diagnostic tests that are used to measure the amount of electrical activity in muscles and nerves in the body. There's even another test that's blood and urine studies, which include high resolution serum protein and electrophoresis. So thyroid and parathyroid hormone levels, and it's usually a 24-hour urine collection for heavy metals. There's even a spinal tap, x-rays that include a magnetic resonance imaging, which is an MRI, and there's the myelogram of the cervical spine, and there's muscle and nerve biopsies that you can also use to test this. So for some of the words, there's neurological, which is pertaining to the study of nerves, electrodiagnostic. There's also electromyography, which is a process of recording electricity in the muscles. There's serum protein. There's electrophoresis, which is carrying or transmitting of electricity. And for myogram, that's a record of the spinal cord, muscles, and nerves. So biopsy process of removing a small piece of the living tissue for microscopic examination. Complications of ALS can include incapable of caring for oneself, so not being able to care for yourself anymore, lung failure, your lungs not functioning at full capacity, which leads to a ventilator that will eventually be required, bed sores from being in bed or from the disease itself. It's tearing down the skin and breaking it down, aspirating food, paralysis, pneumonia, pressure sores, and even weight loss. There's some treatments, but there's no known cure for ALS. There's different medications that do help with the disease, but it's there's nothing to just stop it. So no cure. The average survival rate is 3 years. So there's these different a few different treatments. The first one we're going to talk about is Riluzole, which is a medication known to improve life expectancy by 3 to 6 months. So that does give you more time. There's Endervone, which is an intravenous treatment given to help with daily functioning. So that's supposed to help you as well. There's mechanical ventilation, which helps with breathing once no longer able to do so independently, because like we said about the lungs not working at full capacity anymore. There's even physical therapy that helps maintain physical and physical strength for as long as possible.